faces and names. We are recording this. If you would not like to have your face recorded or anything, you are welcome to just turn your video off. I also need to apologize in advance because my cat has decided this is the exact moment he would like to be screaming. So if you hear cat noise in the background, everything's fine. He's just hyper. But again, we're really happy to have everyone here as we wrap up our year with our December National Volunteer Call. It's been a really successful 2021, and we are, still fighting for the Global HER Act to pass. We're still so happy to be in coalition with all of you as we do this work. And we are extra thrilled tonight, or this morning, depending on where you are, to be joined by Dr. Joan Castro, who is the Executive Vice President of PATH Foundation Philippines. So before we get started, I would love to do some brief introductions. So to start off, my name is Lauren and my pronouns are she and her. I am the advocacy specialist at Population Connection. And I also want to get to know you all a little bit better. So we're going to take a quick moment in the chat. If everyone could please type your name, your pronouns, where you're joining from today. I think it's really cool to see where everyone is, not only in the country, but around the world, joining this call and hearing this conversation. And then I also want to know what your favorite holiday activity is. So whether it's like drinking a hot chocolate by the fire or going to tell Santa what your top gift is this year that you'd really like him to bring, whatever it is, throw that in the chat. And then in 3, 2, 1, go for it. All right. We have Maine, New Jersey, New York. Love it. Terrible Christmas movies. That's awesome. I'm also a big Christmas movie fan. I've never seen Santa Claus Conquers the Martians, but I will certainly add it to my list, Jeremy. Great. So thanks again, everyone, for sharing. We're loving to see this, and to all be back together during the holiday season is awesome. So before we go ahead, I would just want to cover a few housekeeping items. So first, please keep yourself muted. While we're all in this space together, we want to be able to hear our speaker and hear the facilitators throughout the course of this call. If you do have any questions, please put them in the chat at the end of or towards the end of our hour together. We will be doing an audience Q&A section, and so our staff will be tracking all of the questions that you ask in the chat. So I strongly encourage you, as you're listening to this incredible presentation, to be putting your questions in the chat box that's at the bottom of your screen. We also have taken some steps to ensure that this is a safe space, but it is possible that some trolls enter our room, our Zoom room. If you do, you will see this image. I'll put that up on my screen, and we will work quickly to get that person removed from the Zoom room. And once they've been removed, we will get going on continuing our conversation. So before we get into our conversation with Dr. Castro, I just want to give a little bit of an overview for the folks who are new to this space on who we are. So Fight for Her is a campaign that was started by Population Connection Action Fund in 2017. We have been mobilizing against attempts to roll back access to safe, affordable, and comprehensive reproductive health care around the world. I think this is particularly pertinent, not only in general, but especially this week after yesterday, we heard oral arguments in the Supreme Court against Mississippi's abortion ban. As we talk about these conversations from a global level, it's important to keep in mind that these attacks are happening at the domestic level as well. And we stand in solidarity with the reproductive justice, rights, and health community as we fight back against these bans. And currently, we are the only group on the ground that's doing grassroots activism on repealing devastating policies like the Global Gag Rule and the Helms Amendment. And so we're really proud of that. And we've accomplished a lot. So since 2017, we've engaged over 66,000 constituents on this issue, which is super impressive. And One of the first things President Biden did when he took office at the beginning of 2021 was to rescind the global gag rule. And we are very proud of the work that we all did to make that happen. And now we need to pass the Global HER Act to make sure that the global gag rule can never be reinstated by a future president. And so at the end of this call, we'll be sharing lots of actions that we can all take together to make sure that this is a reality and that this happens this year. So we are so grateful to have everyone in this movement with us, and we're so grateful to all be here together. And with that, I'm going to kick it over to Yasmin, who is our brand new National Field Manager, to introduce herself and Dr. Castro, and we'll get started on the great presentation we have tonight.
Awesome. Thank you so much, Lauren. And hi, everybody. So as Lauren said, my name is Yasmin. I use she, her pronouns. In the chat, you can see that I am from New York City. And that's where I'm joining you from tonight. A little bit about me. I'm actually rejoining the Fight for Her. I was an organizer with the Fight for Her on the ground back in Lehigh Valley, Pennsylvania in 2017. So if any of you are from that area, I'm really excited to be back fighting with you, and have spent the past several years actually working on anti-violence and anti-militarism work. But so excited to be back working for reproductive rights. But enough about me. Our speaker tonight, as we've mentioned, is Dr. Joan Castro. And she is a public health specialist with over 20 years of experience with management, leadership, technical responsibility. Her areas of expertise include strategic planning, policy advocacy, capacity building, women in leadership development, and so much more. She's worked with the international and national organizations, both public and private sectors, in health, sexual and reproductive health and rights, and population health and environment. So with that, welcome, Dr. Castro, and I will turn it over to you. I know you have a wonderful presentation set up for us.
Thank you very much, Yasmin, for that introduction, and greetings everyone from the Philippines. I'd like to thank you all for making me a part of this meeting and an opportunity to share with you about what my organization is all about and the work that we've been doing specifically on population health and environment. Next slide, please. PATH Foundation is a non-government organization. It just turned 29 years old very recently. We are registered in the Philippines and also recognized by the US IRS as a charitable organization. We implement programs and we also provide technical assistance to other organizations. And while we are based in the Philippines, we've also been working in other countries like Africa, East Africa, with some of our projects, particularly on population health and environment. The first project that we implemented was actually on PHE was actually in 2000. And since then, we've been implementing PHE approach as a project, as a program for the whole project, where we've been trying to integrate it in sectoral programs that we've been doing. Next slide, please. So I was asked to share with you the PHE initiatives that PATH Foundation has been doing. First, let me provide you a context about the Philippines, why, how, when we started implementing projects using the PHE approach. And the state of the population, health and environment at these points is just to describe it. The country, the Philippines, is an archipelagic country with over 7,000 islands. So you can imagine the coastal communities would comprise a huge percentage of our communities. Over 111 million people, 29% are below 15 years old. So that, as you know, that would really mean what it means in terms of services and requirements as they reach their reproductive age. We have high teenage pregnancy. In 2021, there was a report of about 160,000 teenage households that would be, households led by teenagers. We are a resource-dependent country, particularly fishing and farming. And if you notice this, the graph on the right side, on my right side, as you face the slide, that actually shows the trend of the increasing population since the 60s to the depletion of fish stocks, which is a main source of protein, particularly among coastal communities. So protein would reach as high as 80% requirement. It meets the requirement of protein for people in coastal communities. Luckily, we are part of the mega diverse countries, which means that it's high in biodiversity, and so the resources are really rich. But the irony is that there's very high poverty incidence. 1 in 4 is actually below the poverty level, and particularly among sectors in fishing where PFPI works with very closely, it doubles in terms of the percentage. There's also malnutrition that we've seen, particularly among the younger age group, up to 5 years old. And we experience at least 20 cyclones every year. And so that puts a lot of threat to the livelihood and income and to the services that's being accessed by communities that we work with. Next slide, please. All right. So given the situation of the environment and the population, and understanding the complex and interconnected dynamics between sectors, the needs and the behaviors that pose pressures on the resource warrants an integrated approach like PHE or PED approach over vertical programs towards resilient and human and ecosystems well-being. Next slide, please. So if we put a face to the state of the PHE in country, the women and families we work with, and the stories that we heard would be similar to the story of Jovita in this slide. A wife of a fisher, married early. At the time I met her, she was pregnant on her 9th child. At 37 years old, they struggle as a family to meet the basic needs of their daily needs, and it's compounded with the effects of climate change, where the husband is unable to go fishing during cyclones when the waves are high. While she knows that climate change is what it is all about, it doesn't have a local name, but it is an experience that they have with stronger typhoons, warming sea waters that they think is driving away the fish, which means that there's less fish for the family, poorer nutrition for the whole family, and also poorer health. Next slide, please. So what is PHE approach? It's also called now, more recently in our programs, it's called Population, Environment, and Development Approach. So P would be population, H, health and environment. It places particular emphasis on these sectors, but it's also amenable to agriculture, education, water, clean energy, and others. But the underlying philosophy is fundamentally, take note, a deliberate effort to integrate and collaborate in order to create synergy and value-added research. So both conceptually and operationally, that should be where the deliberate actions are in terms of integration. So it applies a systems thinking framework that will help implementers and policymakers analyze and respond to the environmental conditions by understanding the human needs that influence the behaviors and activities on the state of the people and the environment. Next slide, please. I will quickly go into some of the projects that we have implemented using the PHE approach. And I would start, although I was asked to talk about the current, I'd like to describe to you a foundational program that we implemented in 2000 because it prepared us for a model. It gave us a model on what kind of PHE integrated approach would be most practical and resound. It mimics the way of life of communities and addresses their needs based on the data that we have gathered and over the years that we've implemented this project. The other reason also why I would like to discuss this is because it provided us the evidence on that integrated approach creates synergy. It yields higher results compared to isolated programs or vertical programs. So this program was called Integrated Population and Coastal Resource Management. It was the very first program we did. But the central theme of the project is food security. And it aimed to improve the quality of life of people living in these communities in coastal resources while maintaining biological diversity and productivity of the ecosystems. So the slide shows the package of services that was delivered with, planned along with the communities, and it addresses all the sectors that we need. When you talk to them about their aspirations, it was really having food for the families on a regular basis. They're not even asking for or define what kind of food, but if they had like meals 3 times a day, that would be enough for them. A better future for their children. So that was the trajectory of the programs, like aligning it with the aspirations and the vision of the family as we implemented these programs. And income and livelihood was their concern, and because they were resource dependent, it's really strengthening their capacity to manage their resources and raising awareness and helping them augment or diversify their livelihood initiatives. So that was the first initiative that we had that as I described, is foundational, because the lessons that we've learned were the ones that were scaled up in a global project called Balance. It was a 5-year project where we continued to promote and advocate for the PHE approach. Next slide, please. Next slide, please. Thank you. So currently we are implementing a fisheries management initiative. It's a 5-year project that is mainly working in key marine biodiversity areas where the most underserved and the poorest of the poor sectors in the Philippines work. While it is a fisheries initiative, the organization have found or implemented efforts that would integrate family planning and address the sexual and reproductive issues of women in communities that we work with. And particularly unique to this project is that we were able to help establish women managed areas. And you know that in this fisheries sector, it's usually a male-dominated sector, and bringing women's voice and building, mentoring women to become leaders, being able to manage their own resources and have access and have a say in terms of using those resources was one of the things that was done in the Fish Right project that we were doing. Along with that was also working with the indigenous peoples. And usually these women managed areas are implemented by indigenous peoples groups. And we were able to provide orientation and training and build peer educators, identified and trained peer educators to bring the services, particularly information at the community level. So that is what this project is all about. And the Twin Bacau project in particular is a symbolic project of how to continue to build the value system within the families to be able to watch over their resources. So for every woman who would have a new baby, they would plant a tree in the mangrove area that's specific for this project. So in a way, it was a partnership with the rural health unit wherein they are able to monitor the number of births and being able to bring them to the health center for continuous monitoring and for baby care, mother and child care. And alongside, it was also taking care of the environment. So that was the Twin Bacau project. The other project that we just currently started is the Build program. It is led by AFIDEP. It's a consortium program. It's led by AFIDEP in Africa, and there are 4 hubs. We also use the systems thinking approach in this particular project. But the 2 objectives is to address the interlinked population, environment, and development, and climate challenges for sustainable development by strengthening institutional capacity and increasing commitment for cross-sectoral PHE approaches. Next slide, please. So with 2 decades of implementing PHE, the benefits that we've experienced are consistent across sectors, across ecosystems, across countries, and across the 2 decades that we've been doing PHE approach. Improve food security, income security, poverty alleviation, sustainable, balanced and sustainable development, including livelihoods, human ecosystems health, resilience, and more recently, being able to adapt more to the pandemic. Next slide, please. So I'd like to end my presentation by emphasizing that the PHE approach is a practical response to all the benefits that I've mentioned earlier, and also towards resilient women, community, and families. There is evidence and there are models to show that PHE can address inequities in wealth, status, improve access to services, both health and ecosystems, and lighten the burden of families, especially the women who are noted to be most burdened with climate change. And I will end this slide by describing the role and impact of an improved health and sexual and reproductive health in women. When one mother in one of the sites said, the woman takes care of the family and the natural resources around. If the woman is healthy, the family is healthy, and so is the environment. Thank you very much.
Thank you so much, Dr. Castro, for sharing all of the work that you and your organization, PFPI, has done over the past 20 years. It's really wonderful to hear, but also raises a lot of questions for me, really about how you do it all, because it seems like there's so much to be done. I know you touched on this a little bit, but I'm curious what the unique threats that communities that PFPI serves are facing due to climate change. I know you mentioned a few, but I'm really curious how you've seen that shift over the 2+ decades that you've been doing that work as well.
Okay. I think critical and as you said, you mentioned something that we couldn't change is really the geographic, the geography as an archipelago. So we have geographically isolated and depressed areas just because of that, and that would really mean in terms of the impacts in terms of having access. So there are natural and systems that are there. While we did have a reproductive health law that was passed that would help that in terms of providing access to universal care, I think that actually helped in terms of addressing and prioritizing the issues of women in terms of health and reproductive health, that would have changed and addressed some of the threats because of more of the policy support in general and more funding that came with it. But as you know, that change shifted with the pandemic because of the priorities of the government.
Yeah, that was actually going to be just another question I have. How has your work been impacted by the pandemic, and how have you been working around it? Has pandemic response been integrated into your approach, or has it just made life more difficult for the initiatives that you're putting forward?
I think being agile as an organization, being agile is key. Being able to understand or not look only what's happening within your site and within your country, but also looking at the global issues and how it's impacting them. That in that way, you're being able to adapt to the programs that we do. I think what is key also with our work is that because we have programs in the communities and we have instituted also activities that build the capacity of the communities themselves to be able to address the needs that they have. So the capacity building is key, and so they are not dependent on the organization, but because it's a partnership. Then programs, despite and in spite pandemic and despite distance and the challenges with mobility, then it balances the actions and the results. So you have losses for sure, and adapting to that quickly needs a lot of agility and a lot of foresight as
well. So I just thank you for that answer. But I also just want to remind folks that if you have a question you'd like to ask, feel free to pop it into the chat. This definitely isn't a two-woman show up here. But I actually, so along with that, and you know, we might have lost some ground during the pandemic on whatever issue we're interested in working on, or wherever we happen to be located. I know you talked about some of the initiatives that you're proud of, but are there any, what that PFPI has done kind of is your biggest achievement? What are you most proud of accomplishing?
I think in terms of being part of a trailblazing program, providing lessons learned. We also learned in the process, because when we were starting with the PHE approach, there was nothing on Google. That's what I always say. Now that they already have definition, we were defining it. We were defining what PHE is all about. It's a learning by doing, and it's not, maybe something to say, it's not easy, because working in the health sector is already a feat enough in itself, and you add more sectors to it. And so I can imagine the challenge that sectoral organizations would have, and their fears of like embracing a new sector. But I think that's the biggest accomplishment that PFPI had, that we were able to influence conservation organizations and other sectors to be able to embrace the PHE and and learn what family planning is all about, what population dynamics is all about, that it's not only population growth rate, but it goes beyond that. There's migration issues and size and age and everything.
I'm riffing a little bit because I'm really struck by the idea that you were forging your own path and really selling the idea of PHE to other sectors and other groups. I guess, do you still receive pushback from other sectors? Like, do you have a hard time really explaining the connection between population health and environment, and how do you overcome that, and what's kind of like the line, or what are the lines of argument you use to help people understand that connection the way that you do?
That's a complex question, but very interesting, with a complex response as well. When you look at PHE, you have to look at it conceptually, because local governments and people, organizations would say, we've been doing this because we have health program, but conceptually it needs to come together. And the challenge is making people think conceptually and having to operationalize it in an integrated manner, because they're not used to doing that. So that when you talk about cost efficiency, like for example, in the communities, even if a health person would go there to another village, then ask her about environment, then ask her about health and what's happening. So building the capacity, the knowledge base of that health worker on the environment and being involved is actually some of the key steps, little but very key steps, to be able to show that that is what integration is all about. It is actually much harder to influence or describe what PHE is all about to some policymaker or program planner, but it's easier when you talk to the communities, because they tell you that's how we live. We don't respond to health as health, or our issue is we need food. We need money because our kid is going to school. But then at the back of that, you have to see what are the confounding factors for this family to be able to attain those basic things that they want to have. I don't know if that responded to your question.
It did, and gave me more to think about. But I see we've got some awesome questions rolling in from the chat, so I want to make sure that it is not just my voice up here as well. So the first question we have are there social media accounts where we can follow your work, Dr. Castro? I would love to be able to keep up support. And that is from Nancy. Thank you, Nancy, for the question. Dr. Castro, are there social media accounts?
Yes, thank you. We have a Facebook account. We have a website, and we are also adapting to all these social media platforms, but the youth that we work with, they have, but we're trying to link that up now. So I can say yes, there are, but I don't know how to share. Yes, that's the link, and we're continuing to improve that, and we have also in that link, I think, our Facebook account and Twitter, and I don't think we have an Instagram yet, but we have younger people in the team, so they're also keen on doing that.
An ever-changing landscape for sure.
Yeah.
Another question that I was curious about, what does PFPI do to ensure that vulnerable populations such as the disability community or Indigenous peoples are able to access the care that they need?
As I described earlier, one of the key initiatives that we do for all our programs, and we've adopted this program not only on PHE but also on our sectoral programs, is building community leadership. we identify, we train community facilitators, however we called it, in peer educators, but it's bringing the service at the community level. So they are not dependent on a hard personnel that we have, but it is also a way to sustain that initiative even beyond the project. So we plan programs and activities that we are aware that we're leaving. So we use that support when we are there to build community plans and programs and capacity to be able to implement their own programs.
Awesome, thank you. Next question we have is from Marion, and Marion says, this is such an interesting program. Do you find that your work, that women and their partners are generally interested in using family planning in the communities where you work? Do they see the connections between being able to plan their families and having greater economic opportunities? Thank you, Marion, for the question.
Thank you, Marion. Yes, I will share with you, but not very easily. I'll share with you a story in the Twin Bacau project, because that was particularly with indigenous peoples that we work with in one of the tribes in one island. And we were working initially with women. And we started with reproductive health care, so basic stuff of what reproductive health is all about, anatomy, what do you have, how do you clean yourself, how do you hygiene, and everything. And the right of the woman to say no and yes, or so the rights of the women, reproductive health rights of the women. And what is interesting was that it encouraged the women to bring in their husbands, to say, I've learned this, and so you also have to learn this, so that when I say no to sex to you, then it's because it's my right to say no. And so if we want to plan and make a decision to plan if we will have another child, then that makes it a partnership decision. So those are little stories, but very meaningful stories of what success is all about for programs in the ground. So we can work with women to influence the husband in some sites, and for some it's easy, for some it's not.
That's super empowering for them, I'm sure, to learn something and bring someone else into it as well. So I'm curious, I know we've talked about the successes that you've had, but what barriers still exist for some communities in accessing family planning and mitigating climate change that you've seen?
Distance, mobility, because of the geography, those are the common issues. Remember, the Philippines is 80% Catholics as well. So we continue to have issues on beliefs of the religious beliefs, resisting information and services as a result of their beliefs, and culturally as well. People still feel that children are their wealth, that they are the ones that will help them and bring a better future. So that remains to be a continuing issue. But I think also that as we're getting, so this is different now, because when we started working in the PHE in early 2000, our population growth and the fertility rate was very high. But now we see change from 2020. So we feel that we have contributed to all of this. The challenges are still the same, but in various models. I think also because of the influence of the social media that's educating children to educate their parents may have played a big role as well.
That's amazing, and just goes to show that complex, multi-pronged problems require the multi-pronged solutions that you're offering. So thank you for being resilient and trailblazing this. We have another question. This one comes from Lauren. How has PFPI worked with local leaders to change the narrative or help increase support for reproductive health supplies in rural communities?
One of the early programs, the very first programs in the picture is a community-based distribution system. So we work with small convenience stores at the village level to be able to provide condoms and pills. And as you know, pills, well, in my country, the pills, it's supposed to be something that is given in not in a convenience store where there are soft drinks and everything else is there. But that's the most strategic place where you can put it in. How we did it was we had a memorandum of agreement. We work with a local rural health physician to be able to provide an oversight to all these small stores that we have so that they can continue to provide 24/7 because they never close, and even on weekends, unlike as an augmentation to the services that being provided by the health sector, because they close on the weekends and on holidays. But these stores are there, and still the local health physician, which is the government, is able to provide oversight and would address issues at the local level. So that's one way. We also had ordinances that pass PHE as an acceptable, as a policy within their communities, and that's coupled with the national laws that we have that we're doing. So what we try to do to resolve this is we work not only at the local level, but we work at the national level. So it's like cooking up and cooking down to be able to address gaps at all levels.
That's amazing. One last brief question, unless folks, if anyone who's listening has a last minute question, please let me know. But so you've done so much amazing work over the past 20 years, and I know you definitely, as you mentioned, have projects outside of the Philippines now. What are you looking to do next? What's the ultimate vision for PFPI?
Wider reach, more acceptance, wider acceptance of the PHE approach. Because as we premised earlier, it's not easy. It has an implication both to projects, budgets, and policies. So we still have models, we still have programs, but it needs to be adopted on a wider scale by governments and organizations, because we cannot remain to be just models. We need to be able to reach more through these formal institutions and policies to be able to have a greater impact and have more resilient communities, and not only to climate change, but in pandemic and future pandemics to come. I think that's the vision.
So are you partnering with similar institutions in other countries to help spread the model that's been so successful for you all?
The BUILD program that's the objective of the BUILD program. So PFPI is the hub for the Philippines, and we hope to make it the learning university, or the learning point and the learning spot for the region.
Awesome. Thank you so, so much, Dr. Castro. I, for one, have learned a whole lot and I'm just so in awe of everything that you and PFPI have been able to accomplish over the last 2 decades. But with that, I'm going to turn it over to Rebecca to talk about some actions that we here on the call tonight can take.
Thanks, Yasmin, and thank you, Dr. Castro. It was really wonderful to hear about your programs and all of the really good work that you're doing in across the Philippines. So thank you again for being with us. As always on these calls, we want to make sure that you leave with some things to do, and we'll also give you a couple of minutes right now to take some action. We've done a lot of good work this year, but we still have work to do. So first up, and as I'm describing these, Lauren will be dropping some links in the chat. Probably many of you who are on this call have seen this before and signed this petition. If not, we're going to ask you to share the petition that Lauren will drop with 3 friends or family. We have a great movement. As Lauren mentioned, we have engaged over 66,000 people in the Fight for Her campaign, but are always wanting and needing to grow it more. So if you all want to take a minute, and if you haven't yet signed this petition, go ahead and sign it. And if you have, just fire it off to a couple friends. We'll give you a minute to do that right now. Wonderful. Obviously, feel free to keep sharing after this call. Second, we, as Lauren also mentioned, our sort of biggest fight for a long time, and especially this year, has been passing the Global HER Act to get rid of the global gag rule forever. So our second action is an opportunity asking you to either thank or yell at your legislators, depending on whether or not they've co-sponsored the global gag rule. You'll get a message depending on what your legislator's done. So if they've said thanks, sorry, not if they've said thanks, you're going to say thanks. If they have co-sponsored the bill, you'll send them a thank you message. It's always important to thank our champions and encourage them to keep fighting, particularly in this time when there's just constant threats to reproductive health and rights. And if they are not yet co-sponsors of the bill, we'll be asking you to send a message really strongly urging them to do so. So it's this holiday naughty or nice action that Lauren just dropped. Go ahead and give folks a minute to go ahead and fire this off right now. Feel free to keep on doing this after this call. And then finally, I'm going to kick it over to my colleague, Victoria, who is our fundraising manager for Population Connection Action Fund. And she is going to talk to you a little bit about how we're able to do all of these wonderful programs. The answer is all of you. So she's going to talk to you for a minute about how to get involved in that way. Thank you all.
Thanks, Rebecca. Hi, everyone. And I want to thank Dr. Castro for an amazing presentation. That was incredible. And for all of you for joining us here today. And I also just wanted to thank you, really, all of our activists, members, donors who have supported this campaign and make this work possible. We really couldn't do it without all of your help. And along those lines, we are a membership organization. So if you are financially able, please consider making a donation to our campaign. A gift of just $5 a month really makes a huge difference in helping us continue this fight for reproductive health and rights for all. And as we've mentioned earlier, this is going to be a hard year next year, and we do have a lot of work left to do despite all the progress we've made this year. And I just personally really believe in what we do, and I'm really happy that you guys are all in this fight with us. So Lauren will drop the link to donate in the chat, and always please feel free to reach out if you guys have any questions or you'd just like to chat. Your support really does make a huge difference, and we're really excited to get going next year. So thank you all again, and I will kick it back to Yasmin to wrap up.
Thanks so much, Tori. And thank you to everyone who's joined the call tonight. It's really great. I know we're living in a digital landscape in a digital world right now through the pandemic, but it's really, really great to virtually be in a room with all of you. As Lauren mentioned, I've just started as a national field manager, but really this fight has been going on long before I was here and will continue to go on long after until we win because of all of you. So thank you for being here in this fight for her with us. And with that, we'll let you go, but please take the actions, share the actions. It's the people power that gets this done, and you are our people power. So thank you, everybody. Have a great night.